Hi, this is Brian Kim. I'm going to share with you case number 136 in the best way to do cataract surgery series. This is a 3 to 4 plus dense lens, and you're going to be able to see double chop, cross chop mechanical fracturing techniques, showing how I'm able to disassemble this lens quite easily, again using mechanical forces without sculpting, cracking, lollipopping the lens. To me, this is the most efficient way to disassemble the lens, and by doing it this way, you can reduce the use of ultrasonic energy by using those mechanical forces. So I'm using a cotton tip to steady the eye, and then this is a corneal marker, which will help me to center and size a rhexis. This is my paracentesis incision. I place it on the right side and then the left side, making sure I'm flat to the iris plane, which will allow me to create a nice corneal shelf, which will allow me to achieve a self-sealing incision. This is intracameral lidocaine, and then some intracameral epinephrine, and this is some dispersive viscoelastic to coat the corneal endothelium and to flatten the anterior capsule. This is a triplanar corneal incision. I make a vertical groove, place the blade into the deep part of the groove, tunnel through the cornea, turn the eye towards me with the cannula, and then I enter. Push some more viscoelastic in. And this is, again, an older case. You can see these are my older capsular rhexis forceps. But I'm able to puncture and then pull down towards me, grabbing the right side of the tear, going around circumferentially, grabbing and re-grabbing. I'm able to follow the corneal mark that I made, which will help me to achieve a well-centered and sized rhexis. Burp some viscoelastic out, and this is the capsular fornix hydrodissection technique. I place a cannula under the rhexis edge contra-incisionally, get a nice wave, decompress on the left side, and then the lens begins to spin on the right side there. Irrigate the surface of the eye, lifting the incision with a chopper, going in with irrigation off to minimize Descemet's trauma, removing the surface epinuclear material, placing the chopper under the rhexis edge contra-incisionally, turning the phaco tip vertically subincisionally, bringing the instruments together, and it crushes the lens in half. That's double chop, placing the chopper around the right heminucleus, pulling it centrally towards the phaco tip, and then crushing the lens between the instruments, and that is cross chop, spreading the lens pieces apart, and then using some vacuum to lift that first quadrant up, getting the chopper around the lens piece, cutting that piece in half, using some vacuum to try to lift that first piece up, and try to encourage it and feed the phaco tip using the chopper, grabbing that adjacent piece with some vacuum, and then again crushing the lens pieces between the instruments, and then emulsifying the lens pieces. Using some vacuum again to grab that piece up, crushing the lens piece between the instruments, and then emulsifying the lens piece. Placing the chopper around that second quadrant now, pulling it towards the phaco tip, trying to crush that piece, using some vacuum to lift that piece up, crushing the piece between the instruments, and then emulsifying the lens piece. Okay, I'm going to turn the lens in front of me, placing the chopper around that second heminucleus, pulling it centrally toward the phaco tip, crushing it in half, placing the chopper around that third quadrant, pulling it towards the phaco tip, dividing that third quadrant in half. Using some vacuum to grab that piece, emulsifying it, grabbing that other piece with some vacuum, crushing it between the instruments, crushing it again, and then emulsifying the pieces. Placing the chopper around the last quadrant, pulling it centrally toward the phaco tip, dividing that lens in half, using some vacuum to grab that piece, crushing the lens between the instruments, and then emulsifying the lens. grabbing that last piece with some vacuum, crushing it between the instruments, and then emulsifying the lens piece. You can see I try to use a lot of crushing forces before I initiate a lot of that ultrasonic energy. Grabbing the anterior aspect of the epinucleus, which tumbles out. There's a little bit of that subincisional stuff. I'm able to make it prolapse up, and now the epi is out. So I take the chopper out, push BSS in, take the phaco tip out, and I go in with the INA handpiece. I'm adjusting the sleeve a little bit, making it more anterior here. Starting subincisionally, removing the cortical material from anterior to posterior, peeling it off so it peels off cleanly. Going after the adjacent cortex. Polishing underneath the rexus edge. Polishing the posterior capsule as well. Pulsing BSS into the subincisional capsule fornix, which was clean here. Pushing some cohesive viscoelastic to fill the bag. And then now sweeping with the sweeper. Again, this is that first generation sweep that I was using before. I'm not using that sweeper anymore. Polishing on the left side and then now the right. Again, with these dense lenses, I typically choose a 3-piece lens. So I'm widening the incision here. Placing the barrel in, making sure that the bevel's facing to the left, advancing the lens, making sure the leading haptic is in the bag, twirling my hand counterclockwise so the optic comes out flat. Dialing the trailing haptic into the bag with a Maltzman. Going in with the INA handpiece with irrigation off, activating irrigation. Going underneath the lens, removing the viscoelastic from within the bag, repositing the optic back down, polishing underneath the rexus edge, and then removing the viscoelastic from the anterior chamber, and then I'll hydrate my incision. So again, this is a 3 to 4 plus dense lens. You saw double chop, cross chop mechanical fracturing techniques. You can see the CDE is 2.75. I was able to very easily and efficiently crush the lens into smaller pieces, emulsifying the lens pieces in the central safe zone at iris plane. I had complete control throughout the entire case. I was able to crush the lens pieces and pull them up. I didn't struggle at all to grab the pieces whatsoever throughout the entire case. This is a very comfortable and confident way to do lens disassembly, in my experience, in my opinion. Very reduced risk for complications. I'm not going anywhere near the posterior capsule as I do this, and I'm pulling pieces up out of the bag and then emulsifying them, again, in the central safe zone in the middle. And so this is why I feel like this is the best way to do cataract surgery, especially in these dense cataracts. And again, you can have lower CDEs, in my experience, clearer corneas post-op day 1. So I hope this was helpful to you, and I thank you for your attention.